I'm going to be practicing the subcutaneous injection skill. I would want to follow all GPSP guidelines throughout this entire video. Let's get started. I'm going to show you the injection sites for subcutaneous injection. I would knock. I perform hand hygiene. Hello, my name is Carmen. I'll be performing your subcutaneous injection. Can you just give me your name and date of birth, please? Looks right. Alrighty, is there any allergies that I should be made aware of before we start this? No? Okay. Alright, well, these are the injection sites. I would do the upper arm where there's any excess adipose tissue. And then I would do the upper back as well where there's any excess adipose tissue. And I would do the upper ventrogluteal area where there's any excess adipose tissue. And then I would also do abdomen to the iliac crest, and I would do anywhere from 2 inches away from the belly button where there's any excess adipose tissue, and then I would do it on the upper thigh where there's any excess adipose tissue. And I would perform any assessments that are needed prior to the injection. Okay, I'll go ahead and show you how to inject a subcutaneous injection. I'm going to perform hand hygiene, and I would don my gloves, and before I would follow my 11 rights and do my 3 checks before I administer the medication. And then I would clean my site in a circular motion. And then I would allow it to air dry. And then I will get my pre-pulled syringe, and I would be careful to just grab this part of the syringe. And I would uncap my syringe, and I would make sure to squeeze the skin before injecting it, and I would put it at a 45 degrees to a 90-degree angle. And then I would squeeze, inject, let go, and then slowly administer the medication. And then I would take it out as it was injected in. And then I would put on the safety, and then I put a gauze pad over it. Careful not to put any pressure on it. Go ahead and clean up my supplies. Get my gauze. Doff my gloves. And perform hand hygiene. And then I would document immediately after putting the injection and come back and evaluate my patient for any adverse effects or allergies.